In this series, we interviewed 5 amazing healthcare leaders and experts about the digital health industry in the age of AI and digital transformation. In this video, we asked, what trends or technologies are underrated by healthcare leaders? This is the 3rd video in a series, so if you missed the first 2, check the description.
Let's talk about AI again. You know, something that I think is underestimated in the rush to implement these exciting solutions. I think we forget to look at our data and understand that your models are only as good as the data that you're building them on. And I think, you know, I would perhaps throw out a word of caution that for all kinds of leaders in this space, you really need to understand the data set that your models are built on. You need to make sure if you're trying to, in medicine again, if you're trying to drive forward healthcare innovations to serve a diverse community of people, then the data set needs to be diverse as well. I think that is absolutely huge. And, you know, sometimes I wonder if we skip that step. And I think that you cannot underestimate that. Otherwise, we're going to actually propagate disparities that are really unacceptable. Now is the chance to actually change the paradigm and get the data right so that we are eliminating the disparities and not exacerbating them.
I mean, I think that the biggest challenge that we run into is how can we amplify the physicians, the surgeons, the clinicians without making them worry that they're being marginalized or put aside. I think that's always kind of, you know, that was always the challenge that we ran into is like, we never want to take the clinical decision out of the clinician's hands. I mean, that's always the challenge. We want to make sure that it's the clinician that's making the ultimate decision. That's why it's clinical decision support. And that's why I think a lot of it's being undervalued because they look at it as a toy. And one of the things that I would always say is that as soon as a technology doesn't do what it's supposed to do, it becomes a toy. And when you have a technology that's not delivering, it gets stuck in a drawer. So we need to make sure that the relationship between the technology and the provider organizations and industry are aligned and that they trust it.
I think healthcare leaders are underestimating health disparities. I don't think there's enough research done or prevention work done in terms of African American health and other minority groups. I think that's a real area where the healthcare system needs to improve.
If you think of AI, there are aspects of AI that are creating hype. They're overestimating what it can do. And there are aspects of AI that are totally underestimating. They're not thinking about what it can do or not, right? So it's not about one technology. It's about the application of technology. Like when people talk about intelligence, I go back to a Stanford computer science class, thought experiment, where to explain to students what AI is. Think of a room you're in, and you have a door on both sides, and you have a dictionary that helps you translate something from English to Italian. You get a paper coming in from one door, you use the dictionary to translate to the other language, and you pass that on to the other door. But you don't know what is happening outside those doors. Why is that happening? So that's how these generative AI products are. They don't know what we are thinking and what we are doing. They're just converting what we are passing it to them to the next output, be it a more text, be it image, be it video, be it audio, whatever it is, aspect of it, right? So it's really, it's not really the intelligence that we think of it. The problem is humans perceive intelligence in things that mimic them. So when a parrot speaks in English, it's like, oh, parrot is so intelligent. Well, it's not. It really doesn't understand. All it's doing is repeating phonics sounds that has heard somebody say it, right? That doesn't mean intelligent, but we perceive it as intelligence because you're mimicking it. And because these models are able to mimic language like humans, we think, oh, they're so smart. It's really not the case, right? So a lot of the hype around intelligence and how these model intelligence is too much, but the actual practical application where the model can actually improve patient outcomes and improve clinical workflows, efficiencies, and return on investment, those are being underestimated.
What are they underestimating? I really think they're underestimating data and the management of data and how they need to take care of their data and cybersecurity. The use of resiliency plans being in place prior to an attack and understanding how to develop those resiliency plans. So I really think while we keep seeing these attacks happen, the question is, do you have the proper processes and procedures in place to remediate or to at least understand what to do hour zero of an attack? So data is one, protection of data, protection of internal systems, and making sure that your partners or vendors are also under that same scrutiny for resiliency to be able to help you.
This program is presented by This.Labs, a framework-agnostic consulting firm helping enterprises realize their technical goals through staff augmentation, consulting, project management, on-demand subject experts, training, and other professional services. Find out more at This.Labs.com.